The reason why I am very excited about this initiative is because of its importance. And the reason why this initiative is very important is because, one, diabetes is common, risk for heart failure is common. We can do a lot to prevent the risk of heart failure. But the bigger issue is that there have been a lot of attempts over the years to educate people about the risk of heart attack and what we can do. And so the medical community is engaged in this dialogue. Right now, almost the entire medical community is not particularly engaged or knowledgeable about prevention of heart failure, and only the cardiology community is really engaged right now in treatment of heart failure. But the problem is that most of these patients are in other settings. So the reason why this initiative is really important is because we need to educate the primary care physicians, the primary care nurses, nephrologists, endocrinologists, all of these patients that touch the lives of patients with diabetes, and there is an interaction along with the cardiology community also for prevention as well. And then the timing of this initiative is beautiful. February is the heart month, so that is great. We're just starting right about that time so that we can perhaps link the two things together. So there are multiple stakeholders that we need to be engaged in this initiative. This is not one particular kind of doctor or nurse or subspecialist or patient. I think it's really pretty much all. So number one, to start with the patients themselves. So patients who have diabetes, they need to know the message so that they can go and ask their clinicians the right questions and not ignore their symptoms. You know, one thing is that if you have a heart attack and you have severe chest pain, you're not likely going to ignore it. But if you have a little bit short of breath, a little bit tiredness, a little bit more fatigue, a lot of the people for a very long time can ignore those symptoms, saying maybe it's my weight, maybe I'm getting older, or, change your expectations from life. So one, first is go to the patients and the families and the caregivers to realize these symptoms early and go and talk to the clinicians. The second is the medical community, doctors and nurses and all the medical communities, local non-profits that are involved in the healthcare, local leaders in the community involved in the healthcare, maybe local governments that are involved in healthcare. All of these we need to sort of weave into this thing. And